So as I'm sure plenty of you know, nicotine is one of the most potent cognitive enhancers there is. But today I really want to get into the weeds and the studies on it and how it works, so we can learn some valuable details and also understand how it can be used in a protocol for cognitive enhancement. Okay, so let's start from the beginning. How does it work? How? Through the cholinergic system. Um, so for those who don't know, the cholinergic system is centered around the neurotransmitter acetylcholine, which is important for learning, memory, and also acute attention. I'll get into that later, but yeah, it's important to know that it's very important for acute attention. Um, and this system is enhanced through increasing acetylcholine availability and optimizing receptor activity. Nicotine is a mimetic of acetylcholine, so it binds to nicotinic cholinergic receptors. Um, and what it does basically, as a mimetic, obviously, once it binds to the receptor, it mimics acetylcholine's effects, which is to release neurotransmitters such as dopamine, norepinephrine, and serotonin. Actually, I've noticed that a lot of really popular cognitive enhancers and muscle building agents actually mimetics, um, because they like to alter endogenous systems. Yeah, that's just something I've noticed. Anyways, so research on nicotine dates back to 1960, um, where it has shown positive effects on neurological function. Researchers noted specifically its ability to increase dopamine, serotonin, and norepinephrine in the hippocampus and frontal cortex. But honestly, people have known its cognitive enhancing effects way long before, because obviously, as I'm sure many of you know, lots of intellectuals, particularly in the past, don't see as much in the modern times, but the old intellectuals such as Einstein, Darwin, um, Freud, all of these guys, they nicotine was a big part of their lifestyle and their day-to-day activities. Um, Nicotine has been linked multiple times to a lower incidence of Parkinson's disease among smokers, and that is one of the very few health promoting effects smoking has, and it's primarily due to the fact that there's nicotine present in what the smokers are smoking. So obviously, I'm not recommending smoking, but I'm just obviously there are other ways of getting nicotine, but yeah, just to be clear, not recommending smoking. It's terrible for your health. And today, obviously, I'm looking at its cognitive benefits, um, and that's the sole focus on uh, the nicotine deep dive today. So we're not going to be talking too much about its effects on the body. A little bit about side effects and particularly how to minimize them in a protocol. All right. Anyways, so one thing I want to really make clear is nicotine has a U-shaped dose response curve. So just imagine the shape of a U. Um, obviously the right and left side much higher, the middle is the trough. Too little, you're not going to get any effects. Too much, you're going to get anxiety, a feeling of overstimulation, and also brain fog. Brain fog, obviously, because it's causing this acute release in dopamine, serotonin, norepinephrine. So it's really, really critical you dose it correctly. The dosage is key. Okay. Nicotine modulates something called a DMN, default mode network, and CEN, central executive network. So it reduces um, rumination, and it enhances tasked, focused thought. Very important. One of the particular applications which is very interesting to me is for conditions such as depression and ADHD. No, sorry, it's the ADHD application that's very intriguing to me. Um, it's been studied quite extensively, and there is some promise in it. Obviously, I'm diagnosed with ADHD, so I found this line of research very intriguing to go down, and I'll touch on it later. All right, let's get into the considerations. First, dietary choline. So, choline is obviously a precursor to acetylcholine, and you need it, even if you're not trying to, achieve cognitive enhancement. You just need it generally day to day for basic brain function. The general consensus is around 500 milligrams of choline daily in your diet, but that can be also done through supplementation too. Also, if you're someone with genetic methylation issues, you might want to go a little bit higher than 500 milligrams a day. Okay, what foods can we look at to get choline? I'm sure a lot of you guys know eggs. They're very well discussed in their choline concentration. Also, liver and soybeans are rich in choline. A practical tip, just test how much choline you're getting through chronometer. Log in your diet, see how much choline you're getting, and then adjust accordingly. Also, yeah. So just be particular about it. Be tenacious. I want to touch on the supplementation for choline because this isn't something I see discussed that much. So the supplemental forms of choline is CDP choline, and I always struggle saying this, phosphatidylcholine. I'll put it up on the screen just in case you don't know what I'm talking about. The reason why both are particularly important supplemental forms is CDP choline is hydrophilic, whereas the other is lipophilic, and hydrophilic forms easily cross the blood-brain barrier, whereas lipophilic forms go into long-term cell health and integration into the membranes. The hydrophilic form in particular, since it easily crosses the blood-brain barrier, it will lead to more of an instant acute impact on the acetylcholine system. Okay, another consideration is for those obviously with the prescription only. I don't encourage what's it called? I don't encourage recreational use, but donepezil. If you don't know what that is, it's a medication prescribed to Alzheimer's patients, and it inhibits acetylcholinesterase, which is the enzyme that breaks down acetylcholine. So obviously, inhibiting this enzyme increases the amount and activity of acetylcholine. So it's hard to say what the recommended dose is because obviously I don't make recommendations, and the recommendations from doctors are, for specifically for treating Alzheimer's, but arbitrarily 5 to 10 milligrams will elevate baseline acetylcholine levels for a non-Alzheimer's person as well as Alzheimer's patients too. And also, actually, I want to mention that donepezil is one compound I'm very interested in, and I've mentioned it in my limitless pill protocol, which I'm going to publish very soon. It's also a sigma-1 agonist, so if you have a prescription for ADHD stimulant sort of thing, I'm not going to mention them by name, but sigma-1 agonists, they enhance how these ADHD prescription drugs work. Okay, now I want to get into something called the NicotinePLUS Protocol. So source of nicotine, you can either use snus or pouches or Nicorette gum. I prefer just Nicorette gum because of ease, but obviously pouches are going to get absorbed faster. Dose, Start with, sorry, I just need to adjust 1 second. Start with 2 to 4 milligrams, and you really want to adjust based on your sensitivity. So I recommend a personalized step-by-step approach, never following an arbitrary rule. I know I just stated 2 to 4, but try 1 or 2 if you feel good, and you think you could tolerate it. Try 3 to 4, and if you feel good on 3 to 4, or you have a past history smoking, or a certain genetic polymorphism, or you don't feel any improvement on 3 to 4, you may want to consider higher. But for most people, it's going to be between 2 to 4 milligrams for Nicorette gum and snus. There's other ways of getting cholinergic activity, alpha GPC, pyracetam, and uridine monophosphate. Dosages 300 to 600 milligrams for uridine monophosphate, 50 to 150 or 200 milligrams for alpha GPC, and for pyracetam 400 to 800 milligrams. One thing I want to mention about pyracetam is it's often counterfeit because it's a prescription, so you need to really be careful about the quality you're getting. Obviously, not encouraging recreational use. Only use it with a prescription, but you know, just be careful is all I got to say about that. Circadian considerations. So honestly, for every single compound, whatever I consider taking or using, prescription, non-prescription, I always consider my circadian rhythm, how this compound will interact with circadian fluctuations. So naturally, acetylcholine levels fluctuate, peaking obviously during the day when your attention needs to be at its greatest, and at night, obviously, while you're sleeping, it's at its lowest. So choline-rich foods should be taken in the morning, and also to prevent receptor desensitization and helping maintain sensitivity, you want to consider taking days off. All right, let's talk about a step-by-step personalized approach. Nicotine, especially, you really need to monitor your individual response. Experiment, find your optimal dosage combination, see if it works well with your donepezil prescription, but be careful, it will heighten your sensitivity to nicotine, so you really need to be careful when adjusting the dosage. A common sign that you have enhanced cholinergic activity is vivid dreams. Okay, that's all that I'm going to talk about today. I might do a follow-up video, but if you enjoyed it, give me a like. If you want to book a consultation, check out my website, intelligentpersonaltraining.com, and stay safe. Have a good one.